BioBalance Healthcast, Episode 91, External Signs of Disease.
BioBalance Healthcast features conversations about positive aging, covering treatment and solutions that include bioidentical hormone pellet therapy, safe and affordable skin rejuvenation, and spa-quality botanical skincare. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
So I was at a restaurant the other day with a friend, and somebody walked by that looked unusual. And my friend looked at me and raised her eyebrows and said, "Why don't they know?" And then the next thing my friend said was, "Don't they have a mother that looks at them or dresses them or whatever?"
Yeah.
So I started thinking about the fact that all of us make observational judgments. And who's the guy that wrote Blink? The same one that
Malcolm Gladwell.
Malcolm Gladwell wrote Blink, and he says,
I love that book.
You take this assimilation of all the data that you know, and you make an instantaneous judgment just based on a fraction of a second of perception. And so I got to thinking about how, in training psychotherapists to be therapists, how much I emphasized on nonverbal behaviors and on being able to make assessments and what I call rolling assumptions. You look at the situation, you make an assumption about, well, this is what I think is going on here, and then you acquire data. And as you acquire the data, you roll the assumptions off and replace them with new ones, or you confirm them and you go on.
And in medicine, it's a skill that we're taught, that we have to look at every single part of a person that's sitting in front of us, not just their looks, their skin color, their hair, their eyes. Before we touch a patient, we sit and do a history and we observe. We look at what they do with their feet. We look at what their nails look like, what their fingers look like, what their palms look like while they're talking.
Right.
We look at every single part of their body and make an assessment, but it's not unconscious. It's trained. It is very conscious, it's very trained, and now I can't get it out of my brain.
Well, and that's
I have to have that now. Now that's part of me.
That's what I train therapists to do. I said, everybody does this. It's a skill set that everybody has. The difference between you as just a person doing it and a professional doing it is that the professional is trained to bring it into their consciousness. And once you're conscious of it, you cannot not do it.
That's right. It's like having clues to a mystery. I always look at a patient as, when I first meet them, and I shake their hand. Is their hand cold? Is how do I feel?
Some
like
part of your brain is tracking that all the time.
Right, but I'm going to note all of these things in the physical exam, even from my observations. But they mean something, and so today we're going to show you, so that you can be a sleuth. You can look at yourself. You can look at your children or your family or strangers, and not in a critical manner. I'm not trying to get people to go, like your friend said, "Oh, doesn't she know?"
Yeah.
That's not what I'm looking for. I'm looking to teach people what I see when I look at somebody and show obvious signs of disease, because you want to know that. You want to know that you have a disease before you just show up at your doctor's office for something else.
Well, look, we were talking about, one of the things you're going to talk about is people that walk sort of lean forward, like they're walking against a strong wind. I was trained, especially when looking at boys, young boys, that young boys who walk that way have very negative relationships with their dads.
Well, that's a whole different view.
It's a whole different view from what you get when you look at it.
When I look at that, I'm looking, usually it's older people who lean forward, and usually it's because they've had their lumbar spine, they either have pain or they've had their lumbar spine fused, so that they don't have disc problems.
Right.
So they walk like they're going to fall over.
Like cantilevered forward because they're locked in.
Right, and I'm not talking about walkers. I'm talking about people not using walkers, but just people who are walking out there leaning forward. And you can kind of tell by the gait. We also talked about, or you and I were talking about, my dad's in a nursing home, so I go in and I watch everybody come in and out, and everybody's walking up and down the hall. Now, the people in the nursing home in general are on walkers or in wheelchairs, but the people visiting come in, and I was watching one gentleman. He was probably visiting his wife. He was probably 80, and he had one shoulder way higher than the
I'm
other.
sitting here laughing because you're visiting your dad, who's in bad shape and 93, and you're concerned about that. But you're watching the doorway, and you're going, goiter, thyroid, alcohol.
That's exactly what I'm doing. Or there was one guy that like had his shoulder up, and then he was waddling, but he was thin. So it wasn't because he was fat and his thighs were rubbing together. So asymmetry plus the waddle, and he had a little drag to a foot. That was his hip.
Stroke. Hip.
His hip was fused. His hip was fused. It didn't move like it should move as a ball joint, rolling around in the joint. It was just like stuck. So he had to throw his leg around, to walk. So I could tell he needed a hip replacement and hadn't gotten one, and probably was past the age where he could get one, and so I could tell what was wrong with him by watching. But of course, even though you might think I am, I'm not rude enough to go up and tell them what I think, unless they were to ask me. I mean, if somebody asked me, well, what do you think's wrong with me? I would answer, but I'm not going to. It's just observational. I can't change how I look at people, and it's a big problem when we go out to dinner.
Yes.
Okay.
So yeah.
I'm out to dinner. My poor husband is tortured by me because I'll be like, oh, especially when I was a little younger. Look at that. Goiters were big for me, because I have thyroid problems. So people that have these big lumps in their neck right down here, not just fat, but like a lump down by their collarbone.
Right.
And I'd be like, oh my gosh, look at that poor woman. Her hair is falling out, and she's got a goiter, and she's gaining weight and swollen. Do you think I should go tell her? And John's like,
no.
Stop. Sit down. Eat dinner,
Well, and the thinning hair. You see these women whose hair has gotten really, really thin, and you say that's a thyroid issue.
Well, it can be thyroid, but older women don't have any hormones. So when you don't have estrogen, you don't have testosterone to have oil in your scalp, you don't have estrogen to make your hair grow, and your thyroid's on the edge or it's gone, then your hair falls out. And so you could just see the scalp. Yeah. And that, to me, I can look at somebody. First I look at that, then I look at their neck to see if their thyroid's big. Then if I can't see their neck because of their clothing or something, I look at their nails, because nails that are brittle and broken
and have those
ridges
like
all
strong
over
ridge
them
lines.
Yeah. Are thyroid nails, and hair that's brittle and just kind of sticks out.
So the challenge for you, I mean, if I come to you as a patient and I say, Doc, something's wrong, and you run through that list, then you can say, we want to check your thyroid, or we want to put you on thyroid medicine. But if you're in the quick trip and you don't want to lean over in somebody's ear and say, have you thought about having your thyroid checked?
Yeah, I've been this close to doing that, but I don't do that.
Good.
Because that's invasive. That's invading somebody else's privacy, and I don't suggest that after you learn these things that you do that. But if you're looking in the mirror and you see these things, I think you should note them and point them out to your doctor, because he may or she may be thinking about something totally different when she's looking at you. You tell her what's wrong with you, and she's thinking what your chief problem is, and she's looking for those things but may not see this, but it may contribute to your problem.
So you look at yourself and you see these things, or you look at those with whom you have, strong personal relationships.
Yeah, your family.
A responsibility, like a child or a wife or a husband.
Or a best friend. You could tell a best friend.
Absolutely.
That, but let's talk about the biggest problem we have now in the U.S. is diabetes. The fastest growing population of people are obese and have diabetes.
Type 2.
Type 2, not childhood, but adult onset. So when I go out in public in the summer, I can see people.
I'm going to set up straight for this one. Okay, I don't want my little.
Yeah, well, I don't want mine either. But that when I go outside and I look, I'm not looking at like fat. But I see these things under people's arms where they look like they have velvet under their arms. I mean, it's easier to see on an African American patient or person because it's deeper and it's easier to spot. But even on Caucasians, you can see them. These kind of velvety dark lines under their arms in any creases. They have them in the creases of their elbows. They can have them in the creases of their knees. But I used to see them when I put people up in stirrups.
I'm subtly checking myself.
Yeah, no, you don't have it. But when I put people up in stirrups, they would have these creases. It looked like dirt. It's not dirt. You can't wash it off. It's called acanthosis nigricans. That doesn't matter, but that's what dermatologists call it.
I was just going to say that.
And I knew you were. You know everything.
No, I don't.
But this is a sign that either you have pre-diabetes, insulin resistance. You can get this when you aren't even a diabetic yet. Your sugar's not even up yet. But you're going to be a diabetic soon. So you have insulin resistance. That causes that diabetes and polycystic ovaries.
So if you notice that, is there something that you can do to interrupt that cycle and redirect the future?
Yes, you can go to your doctor and say, I have this stuff.
Yeah.
I hear it's a sign of blood sugar problems, either pre-diabetes or diabetes or an polycystic ovarian problem. Can you test me? And they'll test you, and if you have those
if you're far
documented,
if
you're far enough along, or you can, I would say, I want to be treated, so just treat me.
Right.
You can be given metformin, which makes you insulin sensitive. Even if you're not a diabetic, it's a diabetic drug, but it has very few side effects except diarrhea when you're starting it. You can have that for a while and then it stops. But metformin makes your body sensitive to insulin and sugar. You have to change your diet. You have to stop eating as much carbohydrate and sugar. But your doctor can give you something to help. Now, that will also help you lose weight. But you'll watch this velvety stuff go away. It disappears when you're better. And as you get more insulin sensitive, that's really the best drug for it. There's another drug. There's a couple drugs like Victoza that also does that, helps blood sugar and makes you insulin sensitive. So there are things you can do to remedy that, but that's like your clue. You know, you have to have mirrors in your house too. If you don't have a mirror in your house that's full length where you can see your own body, then you're missing the boat because you're missing clues about yourself. And no one's going to tell you, your husband's not going to go, oh, honey, your butt's getting bigger and it's got this dirty stuff on it. I mean, he's not going to tell you that. So you better get a big mirror and look at yourself, you know, and sometimes the people that live with you don't tell you that stuff because they don't want the fallout. They don't want you to yell at them and be mad.
Well, and sometimes if you try to tell them, they get angry. You know,
right.
You say, well, your breath smells bad. Then they get angry that you said that because they're embarrassed.
But you're just trying to protect them from breathing on someone else.
Well, but the point of saying that is there are ways to say that to someone with some more concern and compassion.
Well, that's true.
You know, so you just don't say, hey, your butt's really getting big and it's dirty. You say, I was watching this really fascinating podcast, and they said, so can I look at your, you know.
Yeah.
So
in the light. Yeah, it's really hard to see that in the dark. So.
Yeah.
And anyway, so okay, so here's my next thing. So obviously thyroid goiters are my big thing. Then seeing this on people makes me want to go tell them something.
Right.
But I'm at the gym, and I go to a gym that has trainers. Okay. So everybody's with somebody, which is good. But I see all of these older gentlemen, and I've not ever seen this on a woman at the gym yet, but I've seen it in public. But these guys are working real hard and sweating. Their faces are gray, gray color, okay? When you work out, you should have color in your face. You should have blood flow to your face, okay? I'm not talking about a tan. I'm just talking about blood flow. You should sweat. Not sweating is an unusual, not very healthy thing. So these guys are dry, gray, and they don't have any blood flow to their face. Sometimes they're sweating, sometimes they're not. But that means you don't have good blood flow. That means you're about to have a heart attack.
Okay.
And I mean, if you're seeing your spouse exercise and be pale and gray, they need to go get a cardiology workup. I mean, I have talked to trainers who have then suggested that to their clients.
Right.
Just because I don't want them to have a heart attack in the middle of workout.
Yeah.
I mean, if I could prevent a life-threatening thing, I will talk to
absolutely.
people.
Sure.
But I mean, that's huge. I saw that in my husband's best friend, who wouldn't mind me saying this on camera. And I told his wife, and she talked to him, and he wouldn't go to the doctor. And 6 months later, he had an almost fatal heart attack.
Yes.
And so, if they tell you, go. You know. And so he recovered, and now his face is all. They've put stents in. And so now his face is all pink when he exercises, and so he looks normal again.
Right.
So that's another sign, and that is life-threatening. And I realize that sounds like, I mean, you'd have to look at a lot of people to determine what's normal coloring in a face and what isn't. But
well, but you're in an advanced situation. If somebody's really working out and should be sweaty and flushed and they're not,
right.
That's different than walking past somebody going in the bank and just thinking, well, they look pale.
Yeah,
or they look gray.
That's right. That's right. And even in this case, I didn't stop them and say something that would freak them out.
Right.
I talked to somebody, their trainer who knows them well, and they could ask them if they'd had their cardiology workup this year and things like that. They may even know they have a problem, but they don't tell everybody.
Yeah.
So you ever look at somebody while you're talking to them and you look at their hands and they're yellow?
Yes.
And so it doesn't mean they're dirty. It means they do what I do. I drink a lot of carrot juice, so my hands are a tiny bit yellow. So I drink carrot juice every morning. That's part of my regimen. But if you drink too much carrot juice or you eat too many yellow and red vegetables, your hands can turn yellow. That's not a sign of disease, but it should be a sign that you cut back a little bit on your carrots. And it can be a sign, like in anorexia, the girls usually eat a lot of carrots for some reason, and they usually have yellow palms, but they also are emaciated. So that it's a little easier to put that together. Now, yellow palms can also mean that your bilirubin's up. You have an obstruction in your bile duct, so your bile is going back out into your bloodstream, and so that can actually be kidney or gallstones, or that can be a pancreatic tumor. And the pancreatic tumors, usually it's not just the palms of your hands, but it's inside your eyes. Any kind of liver disease can cause yellowness, but that's something, if you're not...
hepatitis?
Hepatitis.
And that would be more than the palms and the eyes. That would be like the whole skin tone
Usually you see a little yellowy skin tone. If somebody's really tan, it's hard to see. But you can see it if you pull their eyes down and look here, it's yellow. Okay. And the whites of their eyes can turn yellow. So that's really severe.
Yes.
Painless jaundice. Jaundice is what we call yellow all over. Painless jaundice is the sign of pancreatic cancer.
Wow.
So that would be all over. But you may start with looking at somebody's palms,
right,
because the easiest place to see the yellow, and then start looking at the rest. And then and that would be something you'd go to the doctor with if you're not eating a bunch of carrots and red peppers and tomatoes. So so you would know that, or the person that had that would know that. So that's let's see. Oh, my other favorite. You can tell when you shake hands with somebody. You should feel the temperature of the hand as well as the handshake in terms of being strong or not. You can kind of tell if somebody's well, if they actually grip your hand. If they do this, they're usually either their hands are damaged, hurt, or something, or they aren't feeling well, they're not feeling strong. But when you see hands turn first white, then blue, then red, then
they're patriotic.
They're patriotic. But patriotic palms and patriotic hands, actually that's what we call it, is Raynaud's disease.
So this is splotchy red-white?
No.
No, it's all over.
White.
Okay.
All white, and it's usually here down, all white, and then all blue, excuse me. It's all red, all white, and then blue, and then it comes back to normal. Okay. It loses blood flow, basically. Okay. So as the hand has vascular constriction, it loses blood flow to the hand, and so that's why you get the color change.
Right.
So at first it gets really red, and then white.
Do they get numb? Like
and
if you tie a rope around your hand and
it's just like putting a tourniquet on. It gets very painful. It's an autoimmune disorder. Your body's fighting your nervous system and making your vessels contract. And constrict. And so you don't get blood flow to your hands. That's what happens. But it does release. But it's very painful, very upsetting. You can't go out in the cold. You have to wear gloves. Feet can do the exact same thing. Okay. So that would be a sign that, yeah, you probably need to see your internist about that. There are some medications you can take to make it better, and some advice you can take to prevent it from happening. You know, stress causes it. Cold causes it. So those are things you can stay away from.
So as a physician, in your office, you would look at someone's feet, like for signs of diabetes or neuropathy. What about their toenails?
Toenails that are extremely thick, blue, yellow, they may be damaged, but generally as we get older, the blood flow from our heart to our feet, that's the longest trip it has to take. Right. Usually our feet are compromised in terms of of oxygen first. And so your toenails start getting thickened. Now, they can get thickened from being damaged in too small a shoe. You keep bumping up against your shoe, then that can cause it. But if they start getting thick, yellow or dark, and your toes start being kind of darkish, usually that means that you're not getting enough blood flow to your feet.
Right.
It can be a compromise in the blood vessels in your pelvis or behind your knee. I mean, people do, they do diversion techniques. They hook a vascular surgeon would hook up your artery here to an artery here if you've got a compromise around your knee. And so sometimes they do a fem pop bypass so that they bypass anything that is compromised, or you have atherosclerosis stuck in there and it's gooed up. So then they have to go around it to get the blood flow to your feet, so you don't need an amputation. But if you, the first sign of that is that your nails start getting really thick and discolored, and no matter if you get pedicures or whatever, it's not going to make it better.
Right.
So you need to do things like exercise.
Because it's not an external problem.
No,
it's an internal problem.
Yeah,
exactly.
And you need to, I mean, there are funguses. I mean, first I would see a dermatologist.
Right.
Then I would see a vascular surgeon. But there are things we have to rule out when I'm giving such a blanket description. But those are the kind of things that you should pay attention to because it's a sign.
Okay, so essentially what we're talking about is that if you're trained to observe, there are things that are visible and that individual people can train themselves to learn about, saying, these are alarms that go off. It's just like your alarm that wakes you up in the morning. Here's an alarm, my palms are turning yellow, my nails are thickening, my hair's falling out, you know, something's wrong.
Yeah.
My eyes are discolored. Then go to a physician and say, I'm having some concerns. Can you reassure me and say, oh, you're eating too many carrots, or is there something more fundamentally wrong?
Well, you'll know if you're eating too many carrots.
Yeah, no, I know that, but the point is we want people to notice these things.
Yeah, and there are then steps to take to generally, not always, fix them.
Right.
Before they become a real, true medical emergency, and you end up spending your time, money, out of work, all that stuff. You can prevent things by being observant.
Yeah. Doc, can you look at my hands and tell me anything? Yeah, you need to make out a will.
That's why you're not a doc.
Yeah.
You wouldn't say.
I don't have that level of sensitivity.
Never say that.
Yeah.
A doc would say, oh, well, let's see, and ask you a bunch of other questions to determine why your hands look like that.
Right.
And be compassionate enough to say, well, I think we need to do some tests, see what's really wrong with you, and then at that point might say something like you just said in a different way.
In a different way. Yeah.
And I don't mean to be making light of that.
So there's actually a lot more information that we want to talk about visible signs. And
clues to your mystery.
Yeah, clues to your mystery. And for those of you that saw the film a few years ago that won the Oscar, The Last Emperor, there's a scene in the beginning when the emperor's an infant, and there's an old mandarin whose job it is to collect and study and evaluate the emperor's poop every day to see how the emperor's doing.
I knew you were going to talk about that. Okay.
Well, that's about as much as I'm going to say, because you're going to get into a whole lot more detail about color and smell and texture and floating and not floating and all that. We're going to do that in another visit.
Everybody poops, everybody has experience with this and understands that poop can change, and it does change with your health. So we will talk about that. All right, so come back for that.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. Follow Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Brett Newcomb can be found at brettnewcomb.com.